Sharon Regional Medical Center is getting back into the swing of things after Tenor Health took over the hospital and reopened it. The hospital system's CEO, Casey Fatch, says the emergency room, inpatient floors, ICU, and outpatient treatments are back in operation. The facility is at about 50 to 60% of where it was prior to closing, and Tenor Health taking over. So here with more on how it's gone so far, we have the Executive Director of Penn Northwest Development Corporation, Rod Wilt. Rod, thank you for taking the time.
Oh, good morning. Good morning. Thanks for having me on.
Of course. So how big of an effort did it take across the board to make sure this hospital didn't fall by the wayside and get back open and running?
Well, I must tell you, we had tremendous leadership from our state legislative delegation, Senator Michelle Brooks, Representative Park Wentling. The governor's office was very much involved in making sure that the employees were compensated during the period of the time when the hospital was shut down. And then the community really stepped up. There were a number of economic development partners led by Penn Northwest that came together, led by the Bureau Regional Health Foundation, to put together a little over $9 million of a low interest loan to help with working capital as well. There's a long road ahead of us, but those contributions were very much needed in order to get the hospital up and running. And then, of course, the community needs to support the hospital. And as you stated in the intro there, the hospital is starting to see a significant uptick in census. The ER has been busy, the emergency department. And now we're working on additional capital improvements to the hospital to tackle some much needed deferred maintenance projects. And the state has weighed in with another $2, perhaps even $3 million of a matching grant to help fix up the hospital. And the big push is now to get the cardiac catheterization lab open.
So at this point, what services are being offered, and what services are they still in the process of restoring?
Yeah, most of the services of the hospital are offered, and I think, as you said in the intro, Casey and his team, they've done a great job, and the physician groups that have come on board have also shown a lot of faith in the future of the hospital. From our purposes, again, it comes back to getting this cath lab open and getting the robotic machine back into the lab and operating. And we're hopeful that we can do this over the next couple of months, and that'll be a big shot in the arm for the hospital.
So what is the hospital seeing when it comes to the amount of patients and staffing levels?
Staffing has been great. I will tell you, from my perspective, sitting on the board of managers, we get a report every month, and we have done a great job. Not we, the team there has done a great job of getting the right amount of people in the right place. So, and we had a lot of staff hang in there through the transition. So I do believe that staffing, although there's some areas that are a little soft, overall, the hospital's well staffed. And, again, it's just a matter of matching up the services that can be provided with the cash flow that's available. And it's going to be a long haul. It's not an easy thing to start a hospital or to restart one. But I do believe that once the capital improvements are made to the hospital, that's going to allow them to occupy more and more of the hospital building, and that'll lead to more services being offered.
And, looking at the big picture, how has keeping this hospital open been beneficial to Mercer County?
Well, it's just absolutely huge. I mean, the direct payroll to the employees in the hospital, we use the number around $6 million a year. The economic impact, which has been provided to us by some independent folks who look at this and look at the multiplier of not only the payroll, but of the amount of services that are provided by the local community in terms of contracts or, just purchasing. That is, upwards of $60 to $70 million. And the hospital continues to be one of the top, maybe 5 or 6 employers in the county. And that's really why Penn Northwest and our legislators and, and everyone involved really, it took a yeoman's effort, but everyone got on board to see if we could resurrect this hospital. And it took the right leadership, too, with the Tenor Health people. So right now, I think we're about where we thought we might be. But I think the future is a little brighter than maybe we anticipated with the amount of money coming into the hospital, the support that tenants receive from their landlord, which is Medical Properties Trust. They have also contributed millions of dollars to this renovation effort of the hospital building. And there's a strong commitment to make sure that the hospital remains intact. And probably the biggest thing that's happened in the last 30, 60 days is they were admitted into the 340B prescription drug program for rural hospitals, and that's going to be a significant profit generator for the hospital when they start that program on October 1st.
All right, sounds like things are looking up for the hospital.
We're optimistic.
Yeah.
We're cautious, but we're optimistic.
All right, Rod, thank you so much for joining me this morning. I appreciate it.
And we appreciate you. Thank